Well done. Next slide, please. My pleasure to introduce Tufan Pati sir. He is the chairman of the committee. He is National Advisory Board member of IAPP, chairman.
Can we brief
has been
Halim?
chairman. Okay, sir. Okay, sir. Sir, over to you. Over to you.
Okay, thank you, Halim. Thank you for being brief. And I have to first of all introduce those two stalwart organizing committee members who are moderators too. Dr. Amrit Patjoshi from my place, is a professor at High Tech Medical College and chief consultant neuropsychiatrist at Amri Hospital and Healing Touch Clinic. Is a direct council member of IPS and is editor of Odisha Journal of Psychiatry, which is indexed. We have with us Dr. Alim Siddiqui from Lucknow. He is also a direct council member, but past directing council member of IPS. He is director of Healthy Minds Neuropsychiatry and Behavioral Science State Center, Lucknow. He is a visiting professor of psychiatry at Eras Lucknow Medical College and Lucknow and GSBM Medical College, Kanpur, guest faculty Amity University. He is the finance secretary of IME Lucknow and IAPP UP UK chapter. Welcome, Alim. And I have to introduce our esteemed chairpersons, AR Vice Marshal Dr. R.C. Das. Is alumnus of Penkashri Medical College, Odisha, and postgraduated from AFMC Pune. He had 2 years of special training in child and adult psychiatry. He is ex-professor and head of Armed Forces Medical College, Pune. At present, he is the professor and HOD of KIMS, Bhubaneswar. He had been head of psychiatry in Departmental Command Hospital, Southern Command and Eastern Command. And welcome, Professor Das. And we have with us Dr. Arvind Brahma from Kolkata. He is the director and consultant psychiatrist of Girindra Sekhar Clinic, Kolkata. He is honorary secretary of IPS Eastern Zone. He is a board member, RCA convener and National Action Committee of IAPP. He is zonal member and National Advisory Board member of IAPP. He has got 7 national and zonal level awards of IPS and IAPP, including prestigious Bhagavata Award and Marfati Award. He also received Mother Teresa Sadbhavana Award for social work. He has more than 50 publications in international and national medical journals, including 3 book chapters. Welcome, Arvind. The team seems to be vibrant, and I hand over the meeting to the chairpersons, who in turn will be introducing Dr. Indra Ramasuga Reddy in due course. Welcome for Cosmetic Therapeutics, which is also unknown to me. Parda khulne wala hai.
Thank you, Dr. Tufan. We'll take up the case. I'll just briefly introduce the topic. Then I hand over to my co-chairperson for introducing the speaker. Better brain, better mind, insight into cosmetic therapy. The topic seems to be very difficult. And I also initially bewildered what he's talking about, what was the content like, because you generally don't find these things any textbooks. But I'm sure he will make the topic more interesting. Better brain is always needed essential for a better mind. There is no doubt of that. Without a better brain, we cannot have a better mind. The question arises, can the drugs, can the therapeutic, psychotropic drugs enhance the brain function so that mind can also improve on that? That's the question mark. Even if it does not improve permanently, can it improve cosmetically? Permanently, I mean removing the psychopathology, curing something, making a permanent change. Probably it's no. But making some cosmetic changes in the brain function, probably yes. If it is yes, if it is cosmetic, then how do you go about it? I think one of the best book is Cosmetic Psychopharmacology, coined by Peter Kanner. He is the person who used the topic cosmetic psychopharmacology. If I remember in 80s when that fluoxetine was invented, name was Prozac. People will be knowing that US is called Prozac. People playing golf in US, where stakes are very high, few $1,000 per a shot during putting. They say, if I golf some few Prozac tablet or capsules, my shots are better. That was the perception that point of time. By consuming a psychotropic drug, if he can enhance his attention, he can enhance his concentration, he can enhance his psychomotor skills, why not? What is so big deal about it? Although it is a temporary phenomenon. But question comes, can this drug change the temperament Can the drug change the personality? Have you got certain drugs which can enhance the normal cognition, even if it's for temporary purpose? Can a drug can enhance cognition? If at all so-called cognition of better, the concept of better is doubtful. What do you mean by better? On what way better? These are few ethical questions comes in my mind. If you use a drug to change a personality, change a cognition, change a memory, how ethical we are? These are question mark, but these are helpful also in some cases. With this, I'm sure Dr. Ramasuva Reddy will make it much more easier. He has a long way to go and he will tell us how good it is, how psychedelic or psychotropic drug can enhance our cognition, cognitions, or personality. I think I should hand over my mic to my co-chairperson to introduce the speaker. Dr. Brahma.
I think sir is not connected. He might be having
Okay. Okay, then let me introduce our speaker.
Yes.
Dr. Idla Ramasuva Reddy. He is director, Bhimans Vijayawada. He does not need any introduction to Indian Psychiatry Society members. He is a well-known figure in Indian Psychiatry Society. But I hope there are few new members who might not be knowing him. For them, I'm just talking a few words about him. He is a graduate from Kurnool Medical College. Subsequently, did his MD and DNB from prestigious NIMHANS, Bangalore. And subsequently, he had a very short tenure in CMC Vellore and JIPMER. And he was a most important part. He was a past president of Indian Psychiatry Society, also president of SARC Psychiatric Foundations. The two important appointments on his crown. He is a well-published author, many recipient, also a recipient of an eminent faculty of National Board of Examination. He has many publications to his credit. Besides that, he is a great gentleman and good friend. With this, I hand over the mic to Dr. Ramasuva Reddy.
So, good evening to everyone. First of all, I want to thank my dear friend Dr. Tofanji and other friends, Dr. Alim Siddiqui and Dr. Amrit Patajoshi, and all the other members of the Odisha State of IPS for this excellent Thursday meeting, which I have been every week I have been watching, and it is one of the best webinars in the recent last COVID times. So I want to thank them for this opportunity. Second thing is when Tofanji asked me a few days back for this, so I said my topics are usually all offbeat topics like cinema and psychiatry, psychobiology of love, then creativity and insanity, psychology of politicians. These are some of the little eccentric or odd topics which I think they are not hardcore psychiatry topics. Then Tofan said, no, something that should be more clinical and practical. Then I said, if you really want a clinical and something like that, I have got one topic which is my favorite topic. That is, of course, that may not be directly useful to us immediately, but probably in the near future, it may all of us should be equipped with that information. He said, what is that? He said, this is the topic, better brains. So he also initially was a little puzzled, but of course, Tofan has got a very good knowledge about this. He has read a lot of literature on this. So this is what is my better brains and better minds. Now we'll come to that. So please bear with me. I may take a little more time and I will be a little fast also in my presentation because there are a little more number of slides. And so, of course, I'm sure it will be interesting. And it is a little controversial topic also initially itself, I'm telling. Initially itself, I want to make it very clear. I don't have any conflict of interest and neither I am supporting this view, which I am going to tell, nor opposing this view. I am just putting some of the scientific and research facts in the last few years to all my colleagues, our psychiatric colleagues. They should be well versed with this information and knowledge of this new branch. Of course, as one of our colleagues just now said, you don't find it in the textbooks also about this cosmetic psychopharmacology. Because of my personal interest, I studied and gathered some information from journals and magazines and newspaper information and from the internet, and so many things I have gathered all this information. So please bear with me. So this is what, next slide will go. Yeah. So the overview goes like this: introduction, case vignettes, studies, other cosmetic drugs, use and misuse, ethical issues, psychiatrists as gatekeepers, what next? So some of these things will proceed. So first of all, so happiness has long been recognized as one of the central aims of life. Everybody, all of us want to be happy always, is it not? So there is the link between happiness and experience also we should understand. For centuries, humans have been using mood-altering agents such as alcohol and opiates in their pursuit of happiness. All of us know, even in the olden times, people were taking alcohol just for relaxation or happiness and enjoyment, and even opiates. We have drugs like cocaine, heroin, LSD, and ecstasy, which increase happiness. They only increase happiness, but they are all habituating. We know that they are not good, and they disrupt the link between happiness and experience. Happiness is different from what you really experience. See, what is the purpose of medicine? What we all practice, the basic medicine. The original purpose of medicine is to heal the sick, not turn healthy people into gods. So all are trained in MBBS or MD to heal the sick. But we don't want the normal people or healthy people to become super normal or super healthy or gods. But what about doctors treating other conditions that are not technical illnesses? We psychiatrists may say that that is not our job, but there are so many of our colleagues, medical colleagues. You see, for example, minoxidil used for baldness. Is it an illness? Is it a pathology? No. Cosmetic surgery for people unhappy with their nose deformity, ear deformity, and looks, facial looks, acne treatment for self-conscious teenagers, gastric bypass for obesity, abortion in an unmarried girl, immunization. See, all these things are not pathologies or illnesses, but still our medical colleagues, we treat. Yeah, you see this. Originally, plastic surgery in the last 50 years, plastic surgery evolved into cosmetic surgery. Initially, whenever we were students, 1970s and 80s, see, when there is a burn or some accident and the deformity, so to make a functional and to correct the deformity, plastic surgeons came into the picture. But now it is more a cosmetic surgery than plastic surgery. Fear of God was once seen as a good thing that held the social order in place. In the olden days, when there were no medicines or doctors, so whenever there is a fear, they used to go to a temple. With Freud, the fear became anxiety, something to be treated, and later with the psychotropic agents, anxiety became a set of anxiety disorders. So from fear, it has become anxiety disorder. In olden days, when there were no drugs and people developed anxiety, as I said, they would go to temples and pray God to relieve their worry and fears. Here you see Michael Jackson, Silpa Shetty, and Sri Devi. Understand? See, they all had no illness, but they got treated by cosmetic surgeons for nasal deformity. And Michael Jackson, a lot of changes in his skin color, nose, everything. So they are not definitely pathologies or illnesses. Of course, even Shruti Hassan, our South Indian star, and Sri Devi, once again, you see the nose before and after, the top before the surgery and the bottom one is after surgery, the nasal deformity. What is wrong if we can change the personality of a person for the better of human enhancement through psychopharmacology? Some future psychotropics, especially antidepressants, may offer the possibility of altering personality traits, both inborn and acquired traits. This is something which we are going to discuss today. Whether such treatment is good or not for the society, that is another aspect we have to deal now. The goal of medicine: patient is the arbiter of his own suffering. Distinction should be made between health and illness, clinical illness and cosmetic. Understand? Patients, ultimately, the patient's autonomy should be protected and promoted. Ultimately, he is the boss. He has to decide whether something is required for his well-being or quality of life. See, we'll take the example of dentistry. Initially, when dentistry was there, usually whenever, unless you get a toothache, people were not going to a dentist. This is in the olden days, maybe 5-6 decades back. Now you see the change. People no longer wait for a toothache to visit the dentist. And even for a whitening of their teeth, they go. There is no pathology, just whitening their teeth. Or even the mal-aligned teeth, as they go to orthodontist to correct the alignment of the teeth. So these are all cosmetic purposes. They are not pathologies. So that's why now dentistry has become more demanding, other than just going for a toothache or root canal, something like that treatment. Yeah, this is the revolution in the psychopharmacology. Listening to Project by Peter Kramer. He is the one first who has given this idea. Cosmetic psychiatry is the enhancement of cognitive, behavioral, and emotional processes in a person who do not suffer from illness or disease. That's a basic thing. You don't have illness or disease, still we treat. So this listening to Project is the one of the pioneers in this. This is the first book he has written. So it refers to the use of psychoactive substances to bring out fruitful changes in individuals without a clinical diagnosis, not suffering from any subclinical conditions also, or any form of psychopathology. Who defines a condition is in need of treatment? Who defines suffering? When a client comes to us, a patient, whether the patient decides he requires some treatment or we treating the doctors or psychiatrists decide him. Suffering is a subjective experience, and who decides how much suffering is enough and tolerable. For example, some acute abdominal pain for some people is too much suffering. But for a young unmarried girl, her awkward nose is much suffering. Is it not? I think we have to accept it. So even awkward nose, that disturbs her quality of life. She has always feeling inferior and not able to mix with others. So these are some of her concerns. So the decision whether she requires something or not will be decided by her, not by the treating doctor. You see this. A small percentage of all patients who visit a psychiatrist have no diagnosable mental illness. Many times we come across some clients, they may not have a clinical diagnosis like depression or anxiety, but still they consult us. They are called worried well or they discontent. They are unhappy with life, but there may not be any clinically diagnosable condition. The blues of the discontent and the residues of those suffering from clinical depression is not so difficult for experienced clinician. For all experienced psychiatrists, you can easily diagnose whether it is a clinical depression or something a part of his day-to-day problem of living. It is like distinguishing between pornography and art. It may be difficult to distinguish it precisely, but you know it when you see it. For example, you see, if somebody sees this beautiful art, somebody may think it is something like a reflecting a pornography. But for a somebody who can understand, who knows, they say it is a master art piece. So for some people it is a master art piece, for some people it looks like a pornography. So the precise decision is done by only by the treating doctor or psychiatrist, whether somebody has got a depression or somebody has got an existential problem or problem of living. I'm going to give you some 4 case vignettes very fast. Please attentively listen to them and then I will discuss a little bit on that. Mr. X has recently lost a job. Now feels sad all the time, feels neglected and lonely, has lost interest in searching for a new job, can't sleep well in the night, has lost weight, feels he is not worthy of life and he would be better off dead. His friends bring him to the psychiatrist for evaluation. No competent psychiatrist in this case would deny antidepressants for this person. I am sure all of you will agree with me. So we diagnose as depression, we treat him with antidepressant. He suffers from clinical depression and use of SSRIs is justified in this case. This is a very classical case. Let us see the second case. Mrs. Jed is always gloomy. There are no problems in her married life or in her workplace. She has all the reasons to be happy, but still she is not able to do so. She feels that there is something missing in her life, and is not able to find what it is. She doesn't know why she is not happy. She attends personality development programs. She goes to meditation classes to fulfill the void, but is never able to come out of it. This case is an example of what we call as existential suffering. It is not a medical condition, rather merely a part of the human condition, or that might turn out to be medical, but it is still too subtle to detect as existing medical. At present, she may not have depression. Of course, we don't know. At a later stage, she may turn out to have some depression or whatever it is. But at this stage, we can call it only existential suffering. Let us see the third example. Mr. Ajit, a 22-year-old MBBS, final year MBBS student, comes to the doctor and requests for a methylphenidate tablet for preparing for final year MBBS exam. There is no history of ADHD or learning disabilities, no active medical problems, no history of drug-seeking behavior or substance abuse. Would you prescribe this young man methylphenidate to help him study for his examination, even though he does not meet diagnostic criteria for a mental disorder? So this is the question now. This is the last case vignette. Mr. Dinesh considers himself to be healthy and fairly normal mentally and emotionally. Every now and then he becomes pessimistic, but eventually returns to his normal temperament of quite happiness, very, very transient moods of pessimism. He is neither fond of company nor shy. Dinesh is a car salesman and he believes that medicines will improve his personality and help him become a more effective in job. The problem is recently he's not able to much of cars. Every day he has got some quota and he's not able to do that. So his boss is asking him, your quota is not completed. So he doesn't know what to do. So he thought, he has read somewhere, he wants to improve his personality and become more extrovert and more social, and so that he can sell more cars and he can become a good salesman. This is his problem. He doesn't have any psychiatric problem. Yeah. Regarding Dinesh, the last case vignette which I said just now, who thought medicines will help him sell more cars without any symptom of disorder, most psychiatrists like us would refuse his request for an SSRI. Is it not? I also refuse. And consider his problem to be cosmetic. He wants only to improve his personality, that's all. Dinesh wants the prescription only to improve his sales. But what about the woman? So in a comparison, okay, this is Dinesh case is one thing which most of us will refuse any treatment or medicine for him. You compare Dinesh case with the what I'm going to say just now. What about the woman who wants a breast reduction? Because it will improve her career as a club dancer. So the club manager says, because of the heavy breast, we can't recruit you, and so the shows are not well attended. So he advises breast reduction. Would her request be refused as well? Not likely if she goes to a cosmetic surgeon, because most doctors would see the physical and the psychological benefits of such a procedure for a professional dancer, because she's a professional, that is her livelihood. Without that, she can't, she will lose her job. So in such a case, when she goes to a cosmetic surgeon, he will definitely do the breast reduction surgery. Understand? There is a social and medical acceptance conferred upon this practice, and why not for people like Dinesh? Now you compare this case with Dinesh. Dinesh also no any obvious problem, but he wants to sell more cars and he wants to improve his personality, change his personality a little bit. Is it possible? Whereas this woman also something like that, without any pathology, she wants to be a successful dancer. Yeah. I think many of you are familiar with these figures. Drew Barrymore, she has undergone breast reduction for, she was a Hollywood heroine. And now you see, even I think I have seen in the newspapers also Kangana Ranaut, who was very much in the news recently with the Maharashtra government. She also had breast enhancement. The top one is a breast reduction. Her Kangana's case was a breast enhancement. So these are some of the examples which we see. There are some studies on normal subjects. Understand? On this aspect, Gelfin and Knudsen. Gelfin et al. Study showed that Prozac had no significant effect on mood, general well-being, or quality of life in normal volunteers. He has studied on normal volunteers the effect of Prozac, when Peter Kramer has said that it has got effect. It is something like giving crocin tablet or paracetamol to afebrile patients. If you give crocin to a febrile patient, the temperature will come to normal. But if you give to crocin tablet or paracetamol to a afebrile patient, what will happen? The same thing what Gelfin said. If you give fluoxetine to a normal people, nothing has happened. That is his observation. In 1999, he has done this study. Whereas Knudsen et al., another study showed that Paxil, that is paroxetine, significantly decreased a person's hostility level and negative effect. They gave less commands, offered more suggestions, and used combined ideas to reach solutions, but there was no change on measures of positive effect. These effects were correlated with plasma level of serotonin. The more the level of serotonin, the more were the positive changes. So these two contradictory studies by Gelfin and Knudsen. A little bit about serotonin and SSRIs. Recent neuroscience research suggests that traits or states, the personality traits or states assumed to be part of human condition, may well be symptoms of biochemical deficiency. High levels of serotonin are associated with euthemic mood, sound sleep, and appetite and pain relief. Low levels of serotonin are associated with depression, anxiety, suicidal tendencies, chronic pain, binge eating, insomnia, irritability, impulsive and aggressive. This all of us know. Prozac, people have described, Norden, another researcher, has described what is called Prozac deficiency syndrome. He says, by which he means a complex of symptoms related to low level or deficiency of serotonin. He has called it as a Prozac deficiency, because Prozac was the brand name for this thing, fluoxetine. Several users revealed that Prozac transformed their inner life. This is the feeling of many of the persons who took Prozac. Some of the ethical issues, I'll be from now onwards, I'll be telling the positive things and negative things about using these drugs, and also some of the ethical issues parallelly. Human nature. There are two very distinct perspectives on human nature and sadness. In one view, life is not meant to be a state of constant happiness, is it not? See, none of us are always happy throughout our life. There are days of happiness and miseries. So no one can be a state of constant happiness, contentment, and well-being. In fact, life is largely a struggle filled with pain, disappointment, grief, and mourning. The experience of pain, fear, grief is the experience of being human. When you experience only grief and fear and sadness, that means you are a real human being. That is the experience of most of the human beings or all of the human beings. And these states must be embraced rather than elevated by psychoanalysis. So some group says that everybody should experience this pain and sadness. Then only you are a real human being. Instead of that, snubbing it by using psychoactive substances. In the other view, some people argue that life should be as fulfilling and actualizing as possible. Pain, anxiety, sorrow, and sadness are symptoms that should be elevated with whatever means. The other group says that no, why should you suffer? When there is some alternative, when there is an option, so take them and be happy always. That is the other argument. Yeah, some of the other ethical issues. Physical pain indicates to us some injury. Whenever there is a pain, that means there is some injury or disease and needs rest or medical attention. Using drugs to ignore pain's warning signs would multiply our injury. Somebody has got a sprain or a fracture. If you just control the pain by using drugs, analgesics, then what happens is probably it will still further damage the injury or worsen the injury, and the disease go untreated and so hurt ourselves more severely. So when the pain is there, you should suffer and try to correct it, not by just taking analgesics. This is the argument. This is a physical pain. When coming to emotional pain, also warns us that part of our psychological, social, or spiritual life also needs healing. So whenever you have got emotional pain, that means there is something wrong in your life, either a psychological life or a social life or a spiritual life. So you require some restoration for that. By suppressing these warning signs, we might cause them. You give a drug and suppress them. That means you might cause greater harm to the people. So better not to do it. This is another argument. How once the subjective experience of existential suffering is understood by others. The another argument is somebody has got existential suffering, like what Case Vignette have said. So how can other person understand? That is her suffering or his suffering. She only knows their suffering. She only experiences suffering. So we are none of them. We can't say that she doesn't require any treatment. Should another suffering be dismissed simply, appropriately treated with pharmaceutical? This is another way. So even existential suffering or problems of living or day-to-day problems or adjustments, so they should be acknowledged and treated so that they will be happy. Hard work is necessary for true healing. If one's genes, childhood experiences, stress, or brain biochemistry contributed to the behavior, then one is no longer responsible for that behavior. Such a wholesome denial of responsibility by the individuals ultimately dehumanizes. For example, if the young boy says that my grandfather was a criminal, my maternal uncle was somebody antisocial fellow, so I have inherited the genes, so it is not my fault. My antisocial behavior is not my fault. It is the fault of my grandfather. It is the fault of my maternal uncle. So he attributes everything to genes, heredity. Then can we support such thing? Then it ultimately dehumanizes. He is not taking any responsibility. He is totally giving the responsibility to the genetic predisposition. So neurological enhancements are self-defeating. If everyone achieved the same relative advantage with a given enhancement, then ultimately no one's position would change. The enhancement would have failed if its purpose was to increase competitive advantage. There is one thing called what is zero-sum approach. For example, let us assume, for the sake of argument, that everyone in the society will take a beneficial brain-enhancing drug. Let us give, in a village, you give the drug to all the people. Their relative positions may not change, but the overall productivity and wealth of the society would increase considerably, making everyone better off. Surely that is a social good. For example, let us say in a classroom there are 30 students. One fellow, the lowest rank fellow will get 40 marks, 40%. The highest mark will be 90%, let us say. So if you give a brain enhancing drug, concentration or memory improving or whatever it is, the 40% fellow will get 60%, 50% fellow will get 70%. Like that, they will increase relatively, and the 90% fellow will make it 100%. So what is happening? Again, the ranks may not change. The 90 fellow, by getting 100, he will be in the first rank, and the 40 fellow, by getting 60, he will be in the last rank. So the relative ranks are same, but the thing is, the overall average of the class will increase. Previously, the average mark may be 60, because 40 was lowest and 90 was highest. Now the average mark of the class will become 70. So the overall productivity, if the same thing happens in the society, if you can improve the work performance of the people by giving a medicine or whatever it is, so the overall work performance of that society or the village or the place will increase. That will add to the production in growth of the society or the nation. So this is called zero sum approach. Yeah, cosmetic drugs. What are the? Of course, we have said about the Prozac or the fluoxetine. Are there any other drugs for cosmetic drugs? For example, methylphenidate. It is a stimulant. People take it as a study aid when, especially in the college or universities. Many people take methylphenidate. Previously, I remember when I was MBBS student in 1970s in Kurnool, before anatomy exams, most of my friends, and of course, I also used dexedrine for some. At that time, dexedrine was available. Now, of course, it is not there available in India. So that time I was also taking dexedrine for a few days just before anatomy exams. So that is called a study aid. Then modafinil, usually used for narcolepsy, but now it is called as a performance booster. Are we targeting the healthy brain? Drug companies won't tell us this, but they are really gunning the market of unimpaired people. Researchers are trying to create a kind of Viagra for the brain. We know the Viagra for erectile dysfunction, but there is a research going on. They want to create a Viagra for the brain, a chemical that reinvigorates an organ that has faded with age. So to prevent the degeneration of the brain cells and to regenerate the brain, so probably some research is going on. Then there are other cosmetic drugs apart from the brain. Just let us quickly go through. Botulinum toxin for the wrinkles and insulin-like growth factor IGF given for muscle mass, decreased body fat and improved skin elasticity. Human erythropoietin EPO has become a new form of athletic doping. Blood doping also increases cognition and executive function. These are some of the other cosmetic drugs used for some of these things which I have just now. Then there is another cosmetic drugs in the research for mentation. Two new class of drugs for memory. One is a CREB, other is apakins. They are class of compounds known to enhance attention span and alertness and facilitate learning and me. These are still not in the market, it's still in the research stage. Hope they may come in the future, we don't know. That's why I said my main aim is all our psychiatrists should be well equipped with these latest developments and also be ready if they come what to do. This is the purpose of my presentation. The research at the University of Maryland and survey conducted by Nature magazine, all of us know, is one of the very standard magazine, international magazine. In 2008, it has conducted a study on its readers. And when it gave a questionnaire, at least 20% of the readers of Nature magazine were using cognition enhancing drugs for non-medical reason. They don't have any medical reason. They don't have any diagnosis, but they said 20% we are using these drugs. Why? They said to enhance attention, concentration, memory, and wakefulness. Not only drugs, even technologies like RTMS and other neurotechnics hold promise of not only changing people individually, but also accelerating economic growth for countries. According to Jack Lynch, editor of Brainwaves, he says that some of the not only the drugs, even some technologies like RTMS and others, which they have got some studies to improve their cognition and other things. If you use that, probably the work performance of the executives or employees will improve. Thereby, indirectly, the production or the production of the society or that country will improve. Of course, there are some side effects. We can't deny the side effects of some of these drugs. For example, main thing is abuse and addiction, cardiovascular, like there may be some increase of blood pressure, insomnia, headache, loss of appetite. Some of the other drawbacks of these drugs are, it seems dehumanizing that an intimate personal function is accomplished by a pill rather than a person, such as psychotherapist. For most of our adjustment problems or marital discord or even erectile dysfunction, some of these things, usually we also say that psychotherapy is very important and very useful. If you just want to manage all these things by just giving a pill and neglecting the psychotherapy, what we are doing is the intimate personal relationship is lacking. They diminish an individual's experience of sadness, which is believed to be morally and developmental necessary. So if you say that no sadness, you take the pill, be happy. People say that sadness is also essential for a person, for our developmental development or for our moral ethics and all those things. Another fear is that psychotherapy will be trivialized and maybe no longer be necessary. If these drugs will come into the market, then I think there is no scope or no role for psychotherapists, no role for counseling. Understand? And the role of psychotherapy may be very meager. These enhancing drugs keep us away from our true self. Is it correct? Another question. Would governments give happy pills free to the masses to keep them happy? You see the first picture, he is unhappy. You give a happy pill, he is becoming happy. That means ultimately, don't give a man fish, teach him how to fish instead. That is another philosophy. Would governments give happy pills free to the masses to keep them happy so that they may not be motivated to do something? against the government if their rights started to decide. You see, most of our state governments, they are giving free ration, free kerosene, free electricity, free health cards, free schooling, everything, free college, everything. So probably the governments are already giving some of these things so that people will be happy, so that there will not be any revolution, or there will not be anything against the government, to keep them happy. Let them be like that, so that by increasing welfare measures, some governments want to do this. We want smart people to be as productive as possible to make everyone's lives better. Really, the society wants smart people always. We want people performing at the maximum, and if that means using medicine, then we should be free to choose what we want, as long as we are not harming someone. This is another philosophy. As long as you are not harming anybody else, if you want to improve your quality of life and be happy, what is wrong in that? Take it. That is another argument. Studying hard is a way to improve academic performance. Of course, nobody can deny. But can we get away with improving by simply taking a pill? See, you have got two children. One son is a hard worker and he studies 10 hours per day, 12 hours per day, and he gets 80 marks. There is another child, he doesn't read at all. Only just before exams he reads, and he will get also good marks. So is there a way, just by giving a simple, the same way, just give a pill even to the averager and make him bright student? Is it correct? Something like that. Use of these brain steroids, in other words, smart pills, study aids, are very common nowadays. Nowadays, I think, and more common in healthy university students, more in the USA. Not only USA, we see even in a place like Vijayawada and Hyderabad, there are so many, especially medical college and engineering college students, they are using all these things without prescription, like modafinil or methylphenidate. They are using. Many of us not aware of this fact. We should realize that. Some use and misuse. New devices like a cell phone or internet can be used or misused. This happens for everything. Does one stop researching the development of novel drugs just because they may be misused? For example, because of cell phone, there are so many disadvantages. A girl's love affair. A girl falls in love because of cell phone. She chats always in chatting and eloping with a boy using a cell phone. Or somebody may plan a murder through a cell phone. So these are some of the harmful effects of cell phone. Does it mean that we should prohibit or should we ban cell phone? There are so many other good uses for cell phone. Just because somebody is doing like that, we cannot prohibit or ban cell phones. Is there any medical drug in the market without side effects? Let us say, frankly, any medicine without side effects. So like that, this psychoactive drugs also may have, or the psychopharmacological drugs, the cosmetic drugs also may have some side effects. Let us also give an example. If someone uses a knife to commit a murder, you cannot blame the knife. It is not the knife's fault. It is the person who uses the knife to kill. So you have to find fault with the person. So you should not find fault with the medicine. You should find fault with the person who is taking. Whether it is right or wrong, you have to decide then. So it is not we should not blame the drugs. Another argument is, Mother Nature has cheated me, so I want to cheat the Mother Nature back. Let me go into the details. Among the normal population are people with incredible memories. There are so many people we see with a lot of good, incredible memories, fast learners. Something in their brain allows them to encode new information at lightning speed. And many people say dates, calendar dates, and all those things. What happened 50 years back, 1950, June 23rd, what day? Immediately they will tell. None of us are offended by their ability. They must have some chemical system in the brain superior to ours. Is it not? Some neural circuitry that is more efficient. So why should we be upset if the same thing can be achieved by a pill? So the nature has given him, or God, if you want other words, God has given him that gift. So why should we offend? If something like that can be achieved by taking a cosmetic drug, why not? In some way, we are cheated by Mother Nature. See, other fellow is having such a super memory and I don't have. So the nature has cheated me. If we didn't get the superior memory system, so far as to cheat her back. So I want again teach a lesson to the nature by our own inventiveness. Seems like a smart thing to do by taking a cosmetic drug or cognitive enhancer. The majority of current research has not been on creating new Einsteins. Of course, this is the thing. We don't want to create new Einsteins out of normal population. However, but rather on helping cognitively impaired people. The main purpose is who are having some cognitive impairment. If you can make them to come to the average level or just above average, that should be the main purpose. If the goal of education is to promote intelligence and brilliance, should colleges condone nootropics? See, every school or college will say, no, our students are very bright. We want to improve their performance, marks, grades, and other things, ranks like that. So if there are some drugs which can, like nootropics, which can increase their performance and intelligence or brilliance, why not? Let them encourage. Who among us is not tempted by the prospect of improved memory, learning ability, and focus? If a research confirms that so and so drug is good, by using that tablet, your son can have an excellent memory, he will get first rank, and his learning ability will be faster, his scores improves. I think all of us will be tempted to try the drug even for our own children. If something, otherwise, we will be disadvantaged. The other fellow, neighbor fellow takes and our child doesn't take, then we will be in a loss. Then would you take a medication with minimal side effects half an hour before grammar lessons if it meant that you would learn the language more quickly? This is another question. If there's that you have to learn grammar and take one medicine before that and you will learn better, would you give your child a medication with minimal side effects half an hour before piano lessons if it is meant that they learn to play more expertly? So by taking a medicine before that music class, if he learns better, of course, why not? Would you pay more for flights whose pilots were taking a medication that made them react better in emergencies? And future a day may come when this is a flight where the pilots are given some medicines and they will be more alert, their reaction time is very sharp, and even in emergency they can handle at any cost. So probably people will pay a little more, another 1,000 rupees more, and take that flight. Would you want residents to take medications, our doctor residents, after night duties on call, that would make them less likely to make mistakes in caring for patients because of sleep, because they have to be sleep deprived the entire night. So they may do some mistakes. So if there is a tablet so that they can take and improve their performance without committing any mistakes, why not? Would you take a medicine that selectively dampened memories that are deeply disturbing? Yes. So ultimately, psychiatrists are as gatekeepers. Such questions are not simply thought experiments. How will you respond to these patients when they turn to you as the gatekeeper in their pursuit of happiness? There is another thing called circular reasoning. What is circular reasoning? In the past, doctors diagnosed diseases and then discovered a cure. For example, typhoid was diagnosed, then the antibiotic chloromycin or ciprofloxacin, whatever has come for typhoid. That was the thing. First diagnosis, then medicine was discovered. Now, the thing is, now doctors have interventions, already we have got some medicines that inspire them to create new disorders. This is called circular. This is another argument. You have got some drug, for example, some paroxetine or whatever it is there. So it is good for social anxiety. So because you are having a drug in your hand, now you want to use it for some other indication like social anxiety or whatever it is. Brain enhancing drugs might ease some of our labors, but as Marino notes, there are still lots of hills to climb and they are pretty steep. Cars, computers, and washing machines, or even robo cleaners have tremendously enhanced our ability to deal with formerly formidable tasks. That doesn't mean that life struggles have disappeared. See, we have got so many things. Previously, no cars, no computers, no washing machines. Now we have got all those things. That doesn't mean that these are mechanical and all these things. But our life has become so easy now. So just because that our troubles are, no, don't think that all our struggles have disappeared. Still, so many things may be there in future to make our lives more happier. Then another thing is medicalization of this, another argument. Some people say that means you are making human unhappiness also medicalization. So everything you are making medicalization of human unhappiness. Treatment for existential problems or problems of living that are not medical in need. That's what already we have discussed. Existential problems, can we treat or we should not treat? That is a normal problem of living, human suffering. Then IQ treatment versus enhancement. For example, let us say in the one person has got a 60 IQ and if you want to improve the IQ, of course there is no medicine for IQ. This is only hypothetical question I am telling. So if let us say somebody discovers a drug for IQ or memory or whatever it is, from 60 if you take it to 90, that is the average, 90 to 110, that is called treatment. That is from disability you are making to the average, that is treatment. If already somebody has got 110 IQ and if he wants to make it 150 IQ, that is enhancement. That is the difference between treatment and enhancement. 60 to 110 is the treatment. If somebody wants for 110 to 150, that is enhancement. What is an existential problem? Something that is a variation of normal today or a part of living may be diagnosed as a disease tomorrow. I tell the example. For example, when we were MD students in 1970s and 80s, that time it was called, I don't know, the youngsters may not know, there was an entity called reactive depression or neurotic depression. And the other thing is called endogenous depression. We don't call now. Now it is everything is called MDD, major depression or bipolar depression. Those days, people with some life problem, if they get depressed, that is called reactive or neurotic depression, where the treatment is mainly psychotherapy or counseling and minimal medicines or no medicines. Whereas the other thing is endogenous depression is biochemical depression, where you give medicines, antidepressants. Nowadays, people say everything is biological, everything is biochemical. There is nothing like reactive depression or neurotic depression. That means the neurotic things which were called in 1970s and 80s, in the olden days, now it is nothing like that. Everything is because of biological or biochemical. So what we were thinking because of life problem or stress now has become a illness or pathological thing. So this is a change. Probably we don't know in future what all we are discussing today may become true. Then another thing called therapeutic chocolate. Human life involves a roller coaster of ups and downs. To feel the fullest of extent of happiness, one must suffer as well. It is the experience of being human. I already told you. You should suffer and then you should enjoy. Kuch pana hai to kuch khona hai. You should lose some and you should win some. This is the basic philosophy of life. At the end of a stressful day, you may desire both to pray about it and to eat some therapeutic chocolate. So you pray God and then also, of course, you enjoy. If you turn first to chocolate, it might be so therapeutic that you may forget to pray. That means you just take a pill or whatever it is, then you forget the God or pray or all these things. The same, for a simple example I'll give, for diabetes, doctors in the initial stage say early diabetics, do dieting, exercise, and no need for medication. And then after later stage, the diabetic medicine will come. Then people will forget dieting, people will forget exercise or walking, then take only oral anti-diabetic or insulin like that. The same thing. Even for sildenafil for erectile dysfunction. In the olden days, when before sildenafil has come, I think all of our colleagues are aware that when a person with comes erectile dysfunction, we are going to the fact analysis, like whether there is any problem with his wife, he doesn't like the wife, or he has got any love affair, or he has got aversion to sex or fear of sex. So we are going into the details and trying to counsel both the husband and the wife to correct his erectile dysfunction, whether he has got any masturbatory guilt because of that he is got nowadays nothing. Viagra is available, sildenafil, any reason, whatever it is, erectile dysfunction, just give Viagra, sildenafil, he will be all right. So this is the one argument. So true healing needs mixture of medical, psychological, and spiritual. So the ultimate philosophy is everything, it requires a combination of psychological thing, spiritual thing, and of course medicines also to be there. Those who desire altered states will find the drug, and those who don't want to alter their sense of who they are will ignore the availability of the drug. The government should stay out of it, letting our own ethical and moral sense guide us through the new enhancement landscape. So this is what? So government should not say you should not take this, they are banned or like that. It all, you leave it to the individual. It is his headache, his botheration whether to take or not. This is a new term which I thought I have coined probably. Psychiatrists in future should be called as quality life consultants, like financial consultants. Now our chartered accountants, some of them are called as financial consultants like that. So probably we should also maybe say a day will come when psychiatrists, our name boards will be like quality life consultant. We are giving the quality of life rather than just treating a schizophrenia or depression. We also give the quality of life. You must adopt the changes you wish to see in the world. That's what Gandhiji has said. Change is the philosophy of life. Over a period of time, political systems made a change from king's rule to police rule and then now to welfare rule. I'll just explain. See, in the olden days, when kings were there, it was a dictatorial. Whatever the king says, everybody has to abide. Then the police rule has come, like whatever the present governments. What is that? Law and order, judges, judiciary system, all these things. From king's rule, which was monotony or monarchy, now the later it has changed to police rule and something like a democratic. Now the latest thing, now the what is happening in our country or many other countries, the welfare rule, like for everything, you free ration, free electricity, free health, free school, free college, everything free. Understand? So from king's rule at one time change to police rule and then coming to the welfare rule. Many of our state governments are doing this. Healthcare system also gradually moved from curative, then preventive, and now to promotional. See, initially our aim was medical doctors were typhoid is there, okay, cure typhoid. Then you have got some other problem, okay, peptic ulcer is there, you treat that. Now then it has come to the preventive side, okay, prevent something. You give immunization or whatever it is, prevent good water and other thing. Now from curative it has moved to preventive. Now the latest thing is even curative and preventive are in the backdrop. Now what is the latest is promotional. You are promoting the health. You want to make a person much more quality of life, give them little more happy and well-being. If we doctors want to be leaders in the healthcare system, we have to also raise from the traditional, our traditional model is disease and cure model. Now we have to go rise to the occasion of disorder, well-being and enhancement model. Unless we rise to the especially psychiatrists will move. not only treating depression and schizophrenia, but we should also consider treating our clients for well-being and also their enhancement model also. Then only probably we have got very good future. This another Elon Musk. I think recently is in the news. The Tesla car and the electric cars and all these things. So he's in he has developed a device. The company is developing consists of a tiny chip containing more than 3,000 electrodes, which can monitor the activity of 1,000 brain neurons. The interface could allow people to control phones or computers. What Elon Musk is doing, especially is doing the research on pigs, but human trials are expected this year. So he has introduced a small chip in the brain. So whatever the pigs, this thing, they can control their, by controlling their thoughts or actions, they can do that. For example, if this chip is introduced in the human brain, if you want to open the fridge, by just your thought, you need not go to the fridge and open the door. The fridge door will open. If you want to open the door, just your thought, we can open the door. So like that, Elon Musk team is doing on this research. Probably we don't know, it may become true in the near future. By controlling your thoughts directly to the cyberspace, these things can happen in the near future. This is another thing what Elon Musk team is doing, the robotic exoskeletons. Robotic exoskeletons are being trialed for use in quadriplegia and hemiplegia for daily living activities. People who are quadriplegic and hemiplegic. So several initiatives are focusing on directly coupling brain or spine interfaces with the exoskeleton to achieve stable dynamic walking with integrated. Like they manufacture some special gloves, special wearing this thing, suits. So by using these gloves and suits, they can perform better like a normal person to a major extent. Ongoing research to teach piano using an exoskeleton glove. They are making some gloves, exoskeleton gloves, so that even in war for army people also, if the army people wear that suit and gloves, their reaction time will be very sharper, and they can run fast and they can travel also fast. All these things are coming, understand, in the near future. This is what Elon Musk is doing. His team is doing this research. Yeah, probably a few more slides I will try to finish. Shortcut. People want to be smarter and healthier than others. That is universal. Anybody wants to be smarter and healthier. If cosmetic psychopharmacology means doing this by taking medications with little side effects, why would not people go for that? This is one argument. Some predict that the trajectory of use would make drugs for neuro enhancement as common as coffee within a decade or two. Initially, when coffee and tea were, people are telling it is bad. Now coffee has become a routine for most of us. So probably within a decade, these smart pills or these cosmetic drugs may become like a coffee within maybe coming another 1 or 2 decades. Be prepared for that. So what to do next? As individuals who combat, ignore, or specialize in this practice, consider the ethical issues at stake. This we have to do. As a psychiatric community, this is the purpose of our webinar today. Why I took this subject is, as psychiatrists, what should is our role? Discuss issues in professional organizations like this. This is a new subject, as our Professor Das was telling. The textbooks also could not find much about this. So we should discuss in professional organizations about this upcoming subject, and also educate in medical schools, residency programs, and CMEs, so that such a subject, people should know that, okay, such a subject is also there in psychiatry, not only in cosmetic surgery and other places. Even in psychiatry, there is something like a cosmetic therapeutics is there. Probably we should also know what is what are the plus and minus, and we should be geared to meet the demands of the clients in future. This is the purpose of this. Yeah. I'm sure a day will come in future. Present is that, for example, some of us will have this car. I am with Sundaram Honda. The car backside they will ride because the servicing, everything is done by Sundaram Honda. Probably this is only my optimism. Whatever you think is okay. In future, a day will come. Somebody may put on his T-shirt. I am with the psychiatrist Dr. Indla. So probably now psychiatry has got a lot of stigma. People are hesitant to come to us. Probably a day may will come when we give these positive aspects, the enhancement, the performance, and other things also. Probably people will be proud to come to psychiatrists rather than the stigmatized and the hesitant. So then they may say that my psychiatrist is Dr. Tofanji, my psychiatrist is Dr. Das, my psychiatrist is Dr. Gautam Saha. A day will come. Probably let us hope that day will come in the near future. So ultimately, man is not going to wait passively for millions of years before evolution offers him a better brain and better mind. See the evolution, how we have seen. Understand, over a period of thousands of years, the evolution has come from the chimpanzees, monkeys to the human being. So it has taken so many thousand millions of years, is it not? So we are not going to wait. Now everything is speed, fast jet speed. So we cannot wait for millions of years like the natural evolution for a better brain and better mind. So what shall we do? Now the time has come to decide whether we want evolution like that, wait slowly for so many years, or we want a revolution. Either you want evolution or revolution, we have to decide, or the clients or the public have to decide. The revolution means the revolution of cosmetic drugs in psychiatry. So that is ultimate revolution. These are some of the references. If somebody is interested, you can give a reference later. So I thank you once again. As I already said, first of all, I want to thank Topanji, Amrit, and Aleem for this opportunity. And also, as I already told you, this is a very controversial subject. And again, I want to make it clear, neither I am supporting these views, I am not contradicting these views. These are some of the things found in the research in the last few years. So I thought I will bring all these aspects to the notice of consciousness of our fellow colleagues, so that we can debate or deliberate and discuss on these things and be prepared. Probably in future, this may become a reality. We don't know. So something is good is going to happen for the humanity. Let us welcome it. With this message, I take leave from all of you. Thank you.
Thank you, Dr. Reddy. Yeah. Am I audible?
Yes, yes.
Thank you, Dr. Reddy. It's really a lucid talk. To put in a lot of passions into it. It's a new talk. It's a new thought, some novel ideas. I learned a lot personally. Although some thoughts, I was seeing some questions. People are a little skeptical. People are thinking it's a big dreams. If it is chocolate drugs come, nothing like that. Who doesn't want to improve, look nice? Who doesn't want to improve good? Why not have a Neuralink? What is so big deal about it? These are nice dreams. I hope things will come true one day. Before opening discussion, can I ask a question? I will play devil's advocate.
Yeah.
You told you are both, you don't support, don't oppose, but only my point that you are, while you are speaking, you are quite passionate about the cosmetic drugs.
Yes.
Is it not throughout?
Yes.
The examples that you are giving with this cosmetic surgery and a cosmetic drug, I feel they are apple and orange. Your view on that?
Sir, last sentence. Yes, you said me cosmetic.
You give a lot of examples.
Yes.
Allogere between
Yes.
the cosmetic surgery, that is Kangana Ranaut, this thing with the cosmetic drugs.
Yes.
I personally feel this comparison is like apple and orange. Your view on that?
I think partly I agree with you, but see, these are the nearest comparisons I can make. See, there is no pathology or illness, but they want to improve the quality of life, their appearance. Ultimately, for example, they want to be the cinema field or whatever it is. So like that, when their physical things, when they want enhancement for improvement or for quality to overcome their inferiority or anxieties or whatever it is, why not for the mental functions also? That is only my argument. So there is nothing wrong. So of course, orange and apple, something like body and mind. Here also I am comparing body functions, body, this thing, and mind. So I think if you say that orange and apple, of course, I take it that way. But definitely that is the nearest comparison analogy I can make. That's what I said.
Thank you. Let's open
these are all real things which have happened in the history, in the Bollywood and whatever you say. All things are happening even today.
Yeah, that's happening.
Thank you, Dr. Reddy. Dr. Bromo here.
Tell me.
It's a very good talk. I'm sorry, there was some connection problem, so I joined a bit late. It's really a very good presentation from your side on such a controversial topic. And what I learned from your talk today, that now we the psychiatrists, like other specialties of medicine, we are also facing this ethical consideration, rather I would say, that using the psychotropic medicines with the intent of enhancement rather than treatment. And I think that is the reason why so-called this cosmetics psychopharmacology is drawing the criticism. What I feel from your view, that what you have spoken at last, that I am not, neither I am supporting nor I am against of this. But if I think most of us who are in the clinical practice, every day we are getting this type of patients, we are more or less, we are using this type of enhancement therapy in our day-to-day practice. We cannot deny that. So I think for that reason, this some ethical standards for enhancement therapy that is absolutely necessary if it is become an accepted treatment. And in that scenario, the patient's expectation of medication or the risk and benefit of this proposed treatment, what you have mentioned, giving some examples, or the available informations based on this clinical and the research experience. I think these all are important. That should be discussed with our patients. As you have rightly pointed out, that giving stimulant may have some adverse effect, or giving anxiolytics may have some adverse effect. So we can discuss this. And as we know that we have learned that biopsychosocial model, so it is not only biological, but this psychological and social factor is equally important. So this existential treatment, I think that this is a need of the hour. So probably in the coming years, that may become official. So I think now the MOC can start the question session. Thank you very much.
Thank you, Brahma, for your nice comments. But one thing is real, whether we accept it or whether we prescribe or not, many students, especially I told you, even in our places, in medical college, they are going to the counters and taking across the counter modafinil, and all these things are already in use without any doctor's prescription. Understand? And they say that it is helping them. So even without our knowledge, without our prescription, is going on. So probably, as you said, we have to, as a psychiatrist, we should probably on behalf of IPS or whatever it is, there should be a discussion again, much more discussion on this, and formulate some guidelines. What is good, what is bad, because many people are taking these drugs. Many people are taking, and some people are also getting that, yes, because of this only I could complete my exams, I could pass with good marks like that. So we can't deny that. So where is the demarcation? Where is the line? What is the things that is going to happen? As you said, the side effects and complications, the addiction potential, all these things we have to think, and probably we have to educate, and all these things. So that is the main purpose of this today's presentation.
Yes, yes.
Dr. Reddy, if you can go to some comments, can you give a brief comment on the question box?
Yes.
Chat box.
Okay, sir. Yeah.
The moderators will conduct it, and
yeah, the moderator asks, it is good. Otherwise, yeah, sir, you can ask, I'll answer. That is better.
Yeah, we'll ask, sir. If you permit us, we'll ask, sir.
Yeah,
yes,
sure.
you ask.
Sir, thank you so much. Sir, I think for me, your presentation was the performance booster.
Sir, can you be a little louder, please? Can you be a little louder?
Yeah, am I audible now?
Yeah, please.
So for me, your presentation was a performance booster. The amount of energy, the life you put in. So for that, that in itself is a performance booster.
So tonight's Alim's performance will be boosted.
Amrit, you said performance booster. Yes. So what is that? What exactly our friend wants to know? Asking.
It's a comment, sir. It was a compliment, sir.
Performance booster. Seeing you with a full swing, lot of energy, that is a performance booster for us.
I said, dear moderators, can they make a comment?
But right now, I am not using. Right now, I have not used any performance booster before coming to this presentation. Probably after this, I may have something.
Okay.
To relax.
So that's a very.
There are many questions in the chat box, and before that, would you like to have a reference to this positive psychology thing that Martin Seligman has proposed? Any views on that? The positive psychology thing.
Sir, I am not well versed with that. Probably any of our colleague can answer this if they can. What our friend is asking, like Tofanji or Alim or any other senior psychiatrist, he's asking about positive psychology.
Yeah, because the positive psychiatry is somewhat on lines of it. A person is not diseased, and
but there the medicine's role is not there. I think it is not the role of medicines, but more of other things like psychological techniques.
Yeah, that is he is talking the same line, but instead of a drug, it is psychotherapy, which can be positive psychology. Person is normal to enhance that thing.
That's what I said. No, see, where is the time for in the speed jet lag, this thing period. So people want everything fast, like fast foods. They want a fast medicine or fast outcome. So they just going taking a pill and becoming all right. going for a psychotherapy sessions for 10, 20 sessions, spending a lot of time and spending a lot of money. This is easily available. So that is one thing, one argument. But that's what I said. So because of this, the psychotherapy will be trivialized. The role of psychotherapy will become minimal, and that human relationship is also lost. That is not good on one side. But at the same time, the common man perception is that you want some quick remedy. So you have to see both the things, both the sides, what the person thinks and what we feel as a psychotherapy is also important. But both, that's what I said. Praying the God and also take a chocolate, therapeutic chocolate. Do both. But if only you take the therapeutic chocolate, you are forgetting the God, you are forgetting the prayer. So do both. Do that and do that, then probably the results will be much good. Don't forget the prayer. So like that, don't forget the human relationships and the interaction and the psychological therapies.
Yes, sir. Actually, Seligman is famous for his learned helplessness theory, and there we know that especially the psychologists, they use this technique, learned helplessness, how to control and how to master the difficult situations, how to control it. So you are absolutely right. Now people are not waiting for that. At the same, they can go for counseling session, but at the same time they need some medication also to get to overcome the situation. Yes,
they are complementary to each other. They are complementary to each other. But nowadays, no, the people want a quick solution, not a psychologist going all these things. We know, but we know even in our day-to-day practice, even though we teach and discuss so many times, but ultimately we prescribe a pill for anything. Then psychological treatment comes only secondary. And also most of the times patient, once he's happy with the pill, he will not go for psychotherapy or counseling also. He thinks, okay, I'm sorry, all right, sir, no need for counseling or psychotherapy. This is what we practically see. So we have to realize the practical realities of life. That's what I want to say.
Exactly.
Sir, what will be your comment on using cannabis or opioid or alcohol as a cognitive enhancer, as a mood elevator, as something to wash away the blues? Now you, because that's a very, very pertinent question with cannabis, with a section of society fighting for cannabis, a lot of youngsters coming to us and telling, I see people who tell I study better, I'm able to focus better. I've seen people telling that my sexual performance is better when I use cannabis. So then what will be your views? And then how are we going to justify telling somebody not to take and telling somebody to take?
No, already I think in many places, even in US and other places, already cannabis has been legalized in some countries. No, I think all of us are aware. Probably my view is probably a day will come even in India, cannabis may be legalized, at least with some rules and regulations. A day will come. But as psychiatrists, of course, now we say that, of course, cannabis is harmful and all these things. Of course, there are so many, as you said, positive effects of cannabis also. But a day will come, I think it is not very far off. The revolution, that's what I said. Whether you go for evolution or revolution is coming in the society. Probably a day will come. But all these things are mainly for, I said, alcohol, cannabis, and opioids. They mainly give happiness. Majority of them give happiness and relaxation, not for the real enhancement. They are mainly for happiness, and at the same time, they are addictive also. No, that is the main argument, is they are more addictive. Whereas other drugs like modafinil or methylphenidate, they are, of course, they are also addictive, but not that these things. Now they are not very harmful like other drugs which you have said. So probably we should be prepared when the day comes when cannabis may be partly legalized also. Already it is there in many countries, as we are aware.
One more point, sir. Cannabis on long-term use may cause amotivational syndrome also. So maybe in the initial phase it can be an enhancer, but in long-term use it may cause amotivational syndrome also.
Yes,
that's a problem. That's a problem with.
That's true. That is true. That's why I said even the drugs, whatever I said, modafinil or whatever. Of course, fluoxetine is not addictive anyway, but other things like methylphenidate or modafinil, all these things at a later stage in the long-term use, they are addictive, highly addictive potential. So like that, cannabis also has got its own lot of negative effects. But why so many countries have legalized it? They have studied and all these things, and still they are using it in a acceptable way. So I think in India also the society changing from the traditional model. Now it is becoming more revolutionary. Things are happening in our Indian society also. We don't know. A day will come when probably we have to also rewrite those things, and we should be prepared for all those things. As I said, motivational syndrome is there, but that's why it should be under controlled this thing and supervised thing, and it cannot be like whatever you want, you take it, and it should not go to the extent of addiction potential. That stage it should not go. That is my personal opinion.
I agree with you about the fighter pilots using modafinil for enhancement. Am I audible?
Yes, sir. Sir, I think you are in the Vice Air Marshal, so you should tell us something about it. Yeah, you are the right person. Tell me, is it true?
I'm not talking about US Air Force. They are using in exercises where they are 4 30 a day, regularly take modafinil because the basic purpose that their attention concentration improve, accident rates decreases, and the landing and takeoff is far better. When they have to take 3 4 30 a day, they take modafinil. It's not now, over few years they are taking. They called go pills.
Is it acceptable in the army? Is it acceptable in the Air Force?
Up late, we have not yet accepted as a norm, but US Air Force, they are using it.
No, is it,
our pilots
legally or illegally they are using?
No. It is a, what do you call? They are using as a part of routine enhancing task. Drug is given to people who wants to take it. In India, people refuse to take it. They say, no, we will not take drugs. We don't have that type of task in our hand. But US Air Force is an option, and many pilots have took it.
So you are supporting the view which I have said. That is good.
Yeah.
There are some positive things about this.
What is wrong taking for 2 3 days? They exercise for 3 to 4 days. They just took it and disappear after that. It's not taking lifelong. For 3 4 days, they just take it during exercise period.
SOS basis.
SOS basis.
Yes, that is good. Probably. Yes, that is a very good thing. We should.
I would like to share
some. Many of us are not aware of this. Many of us are not aware of this. I think. Thank you, Dr. Dasa, for giving us this information. Yeah. Next, somebody is asking something.
I would like to share some information now. Okay.
Please.
Okay, Dr. Reddy.
Sure.
I came across the information about this book because it continued to be a New York Times bestseller list for a particular long time. I was interested long ago. This is in 1990s. So this concept is not a new concept. It was there, but for reasons known or unknown, it has not been popularized, number one. And this book by Peter Kramer, who belongs to a very old medical institute of US, the naming of listening to Prozac, using the term Prozac, means there can be a conflict of interest. I do not know whether he has declared any lack of conflict of interest. And this book was immediately responded by another book by Dr. Bregin, which was also a bestseller, that was talking back to Prozac, and that was contradicting the opinions given by Dr. Kramer. And now the thing is whether we accept as a principle, one, and two, what is the status now for us to contribute to that in your practice? I think we are restrained to use this for patients whom we do not diagnose legally. And it was the same view was also shared by Dr. Friedman, who is known, very much well known to us, and who was the president of API at that point of time when Prozac was introduced in the market. He was also critical of this concept of cosmetic therapeutics. But as in today, I think it is a look into future and deserves attention for research rather than attention for clinical practice. This is my opinion.
Thank you, Tobaji, for your valuable this thing. I think you are already aware of the subject. I think only thing is many of our colleagues, especially the younger colleagues, may not be, because it is not there in the textbooks. Even the comprehensive textbook, I think hardly there is a one paragraph or half a page on this subject. So even the Oxford textbook, none of these textbooks cover this subject. So that's what I thought. And I have already told you my subject is only this type of topics, offbeat topics, not the regular hardcore psychiatric topics.
Excellent presentation and good information for all the audience.
Thank you.
Sir, we have a question. Dr. Dushad Ram has raised his hand. Dr. Dushad, can you come on here?
Please.
Yes, sir. Sir, I am very happy to hear. I had work, but I specifically came to listen to you, and you are as young as 10 years before, and I think you are using some kind of promotional psychiatry. So my question, sir, is that for my limited knowledge, your presentation raised many questions on psychiatry itself. Whether psychiatry definition needs revision, So far we know that it's tried to normalize things. Now the things that it is often influenced by human rights, social development, psychological optimism. So many things are coming, and so many influences are coming. So the world is growing. So do you think, this is question number one, do you think that definition of psychiatry needs now revision? It is outdated?
No, sir. No, Dr. Dushad, I don't think it is outdated, but still we have to add some of the other dimensions also. See, our main aim is to treat the suffering or to treat the abnormal. That is our main our fundamental aim of psychiatry. But what is this? This is a enhancement from the curative, then preventive. Now we are moving to the promotional aspect. So we have to move a little ahead. So even the other physicians or our other medical colleagues also, initially they were curative oriented, then of course preventive oriented. Now they are also going towards the, even I said, the cosmetic, plastic surgeon, they have become now cosmetic surgeons. Dermatologists are becoming cosmetologists, something like that. Or the chest physician is becoming a pulmonologist. So the roles are changing, the names are changing. The same way, probably psychiatrists, I so told probably a day will come when my name board will have Dr. Indla quality life consultant, something like that. So probably we are not only treating the mental illness or abnormal people, probably we are also giving the quality of life. That's why I put one slide, quality life consultants, like financial consultants. So there is nothing, so the traditional psychiatry model should be there. But in addition to that, we should move one step ahead and also say that we are not only, otherwise, the so-called personality trainers, the so-called counseling people and all those people are dominating the picture of mental health, because we are not able to give that. So probably they are taking the advantage. So in addition to treating the sick, we should also, the normal people also, to become little more well-being, to improve their quality of life, mental peace and happiness. I think that also should be added to psychiatry. Not just, we did not change the definition, but we should add that also into our armamentarium. That's what my personal opinion.
Yes,
Sir,
so you mean to say we should be
thank you.
dogmatic.
Sir, second question is the contents say that every individual should have a different kind of normalcy. For example, once breast is obstruction for normalcy, then for me, my normalcy could have been different. For Alim, it is different. For Amrit, it is different.
No, I didn't get it. Alim, can you tell me what exactly he wants?
I think he is focusing on the definitions of normalcy being different for different persons.
Yeah, I think this is a very, very complicated question you ask. Normalcy varies. See, no, we cannot say that normalcy is fixed for everybody. Understand? It varies from person to person. Of course, there are some norms within that norm. Understand? You should not be too much deviant from that norm or that side or this side. But we cannot fix this is normal for this person. Understand? See, a person has got two children, and two may be normal, but one may be extrovert, one may be introvert, one may be high ranker getting 90%, another may be getting only 50%. So both may be normal in all the spheres. But the thing is, they may be two different spectrums. So we cannot say that he is abnormal or he is super normal. So as long as they are functioning within that graph, within that norms, probably we should call them normal. If somebody wants, I said, for example, I think I forgot one example. If let us say one of us have got two sons, one is getting a MBBS seat without any donation, he got merit. Then he gets MD seat also in merit. Then he gets super specialty DM also in merit. Whereas the other son is there, he gets only 50%. The father, as a father, he wants to make him also like his first son, but he cannot get merit. So he will pay 1 crore for MBBS, 2 crores for MD, then 3 crores for DM. Understand? So that means he is using all his resources, which you have used for the first son. He could have gone Harvard or Oxford or whatever it is, but he wants the underprivileged to lift to the like first son level. So he is spending all his money for that. So what shall we call? Whether he is a normal or whatever it is. And as a father, he says that I want my both sons to be happy in life. So these are different aspects, dimensions. So as you said, normalcy and abnormal, normal also differs from person to person. But as long as they are working or functioning within that this thing spectrum, I think we should consider them as normal. I don't know whether I have cleared your question, or if something is there, Tofan or Alim can add.
Yes, thank you so much, sir. Sir, let me just classify the conditions. So one of the condition would be grief or setbacks that we want to take care of, which is not medically diagnosed. We want to enhance the performance in certain sector, and one thing would be we want more of happiness, more of cheerfulness, and all these things we are not diagnosed. So what molecules would you propose in these three sectors? With grief, setback, I want to forget a painful memory. So what would be approach if I say that these are three things?
Yeah, I think usually I prescribe, even though there is no clinical depression, just he wants to forget the unhappy or the negative memories or unhappy tragic memories, whatever it is like that. He is not able to come out. So I usually, if in my personal practice, I prescribe a fluoxetine or whatever it is, that type of SSRI, so that it will make him little more cheerful. Of course, on one side elevating his mood. Once the mood is elevated, automatically his negative thoughts or the tragic feelings will come down. Recently I have seen one creative fellow, one cinema director. He's normal, nothing, no clinical diagnosis, depression like that, but he says he was a super duper cinema director. All recently all his cinemas are becoming a flap. He says that my brain is not working like before, and I want some medicine so that I can again become that. These creative ideas are not coming like before. He was a writer, director, and lyricist, everything. So I put him on modafinil and a combination of fluoxetine. This happened very recently, few months back. This is a real story. And after 2 months, he tells me there is some kick internally. He says, what is the improvement? He says, there is some kick, sir. Now I am not, previously I was feeling little dull and lethargic. Now I become very active and my creativity has become more, and I am writing so many pages nowadays, the stories and dialogues and other things like that. So probably, even though there was no clinical depression or to forget the memories or what, your case was forgetting the past tragic memories. But in this case, what I have said is to make him a little more creative, which was already he was creative. Now, maybe he has got some family or personal issue or something is there which I could elicit. So he's not able to that family issues and personal issues, some problems in the family. So he's unhappy. So by giving this medicine, suddenly he says after 2 months, he could forget all those things and he's now become more creative and he's now going to take again a super duper movie with a good producer. So this is my recent personal experience.
Yeah, so there is a comment in the chat box. These ideas can be misused, and therapists and clients can like those happening in other medical fields. So, how would you prevent misuse?
No, I think as doctors know. Tell me, Alim, you are telling something.
What will be the definition of misuse here?
No, see, I told you, in the colleges, see, in and out of Vijayawada, there are 5-6 medical colleges, at least about 15-20 engineering colleges. We see so many, myself and Vishal, see so many engineering students, so many medical students, they're already taking modafinil without coming to us. A day will come when it becomes too much and they are abusing or then becoming addicted. Then the parents are realizing, then they are bringing to us. It is too late. Already started in the first year of MBBS. Now they are brought in the final year when there are so many backlogs. That stage only they are coming. So nobody knows. The parents don't know or the college management doesn't know. Nobody knows except one or two friends. So that stage should not come. So it is mainly the responsibility of the parents or the supervising people who are with him. They should realize there should be some, if he is taking under medical supervision or psychiatric supervision, probably to come for a follow-up regular and all these things we can monitor. We can give the minimal dosage and also where to stop, when to reduce, all these things. But many of them are taking offline across the counter. So that is definitely bad. That has to be monitored mainly by the parents or maybe by if the management or the hostel authorities, if they come to know. It is happening even without our knowledge. Very, very rampant in our area. I don't know the experience of other colleagues, but it is happening in these areas.
Amrit.
Sir, so I think we are almost reaching the end. So I want to ask you one question, sir. Is it fair on our part to play God, sir? Everything, and who will draw the line?
What Amrit said, is it fair on our part to pray God?
Play God. Yeah. We are playing God. So that is the biggest accusation against psychiatry. Again will give rise to a lot of anti-psychiatry movement. The psychologists, the public, they'll all cry foul of us that we are trying to play God by talking about methylphenidate, talking about cannabis, talking about Prozac. We're going to activate a lot of anti-psychiatry lobby. So is it fair on our part? Where do we draw the line? Who will draw the line? Where will we draw the line between trying to make somebody more happy or trying to make somebody less sad?
No,
Where
that's
our
what
diagnostic criteria.
Yeah. See, in one of my slides, I have said, see, the government, what is the government role? As long as as long as you are not doing any harm to the other person, as long as you are not doing harm to your health and the family and society, you are not disturbing others. I think there is nothing wrong in taking a pill, that too with the advice of your doctor or psychiatrist. So, as long as it doesn't interfere with anybody, I think there is nothing wrong. So, but as you said, if you are misuse it or abuse it or because you become addict, then the problems will come. So that is where the supervisory by the elders or parents should come into the role. I didn't understand the second part. Is it something extra you asked?
So where do we draw the line, sir? Where we should intervene, where we should not intervene?
No, line means, see, for example, we are giving benzodiazepines to most of our patients. We are giving zolpidem to most of our patients. Understand? Some of our drugs are already, we are giving methylphenidate to our patients. Even adult age, ADHD or children, we give this thing, methylphenidate. All these things are, of course, abusing drugs. But clinically, we are using most of them. Clinically, we are using not, is it not? We prescribe. So we know where is the limit. So as long as it is therapeutic and they are coming to the doctor regularly and the parental supervision is there, definitely I think there is nothing wrong. Only thing is out of our hands or out of the parents and then the problem comes. So definitely there are so many indications, medical indications for these drugs also. Methylphenidate has got indication. Modafinil we are using in our day-to-day practice. And then so many benzodiazepines are using zolpidem. But if they are abused, that is their problem, their botheration. But as long as we are treating doctors, we know our limitations, our responsibilities. So under supervision, I think if they take, I think there should not be any objection. That's what I feel.
Yeah, I think sir, that is a fair enough call. If we are following our ethics and everyone is in accordance, then it should not be a problem. The use should not turn into abuse. I think that should be the underlying factor.
Yeah. It should be a medical use. It should be a medical use. Even they said the so-called existential suffering or whatever it is, personality change or improve concentration. These are some of the things which are not actual illnesses. But there he wants to improve his performance or enhancement of his cognitive functions or whatever it is like that. So when he wants to improve and become a better person, so under the supervision of the psychiatrist, if they take the medication under supervision, then there is nothing. I told you recently, cinema director I have been treating, and so he's happy and I am happy. And probably a day will come when he's satisfied. Then I will say that you cut it, taper it off, and stop it. So probably his real person, his original creativity was there. Only recently, maybe because of some family issues, it is dampened. So probably now he's able to forget or overcome his tragic memories. Now again, his original creativity is coming to the surface. So I think if we can do that much, I think we have done a very great deal to our clients. That much, I think we should be happy.
Yeah. That is so.
Dr. Kari Ramareddy, I saw, I think he wants to make. Ramareddy, are you there in this thing? I just now saw. He knows. Ramareddy? Yeah, if he's there,
if sir can raise his hand, we can unmute him.
Yeah, I don't know. I saw him just now. Anyway.
Yeah, I think he made a comment that life is a marathon and we want to run it like 100 meters, and therefore the problems are arising. so what he wants, I think he wants to say is what context we are working. So I think that is a very enlightened comment that would say. Yeah, Amrit, do we have more of questions? I think most of the questions have been answered
Amrit, you are not clear. Your voice is not clear, Amrit. Some interruption is coming in the voice.
Amrit, stop your video and
indirectly.
Yeah.
So
now it is.
No. Chairpersons for the concluding remark. Then
I couldn't listen what he said.
Amrit, you are not audible.
Sir, over to the chairperson, sir. Chairpersons.
So, yes. Dr. Das.
Sir,
Dr. Das and Dr. Brahman, please make your final remarks. Speak before closure.
Yes. Yeah, it was a very, very interesting discussion today we had, and Dr. Reddy has nicely pointed out the pros and cons of this very, the critical issue of psychiatry. Probably we are depending a lot on DSM and ICD criteria about mental illnesses, and that is maybe a area why people are asking this, the question of use and abuse and misuse, all these questions are coming. But psychiatry as a whole, I think not only certain criteria is written in DSM or ICD, we should know the psychiatry means the psychological aspect of the patient as well as the anthropological, sociological, the social values, cultural meanings. But in this age of biological psychiatry, probably we are forgetting that. So what Dr. Reddy has told, I think that is the issue. We need to have more and more discussion on this, and our parent body and probably the organizations working in this field, they will come out with a consensus opinion about this, whether we can go for this enhancement therapy in future or not. So that is all from my side. Thank you, Dr. Reddy.
And 1 minute, Brahma, I'll just take a minute. I just forgot. See, today, just now I saw in our WhatsApp group, tomorrow there is a webinar on neuroscience of jealousy. Neuroscience of jealousy. Tomorrow it is there. So what I'm thinking, so that means, can we imagine that jealousy has got some neurological basis or a biological basis? Usually not. But so that means even some of our personality traits or states, so for everything there is biological, everything is neuroscience, everything is biochemical. As I already told you, in our MD days in NIMHANS in 70s and 80s, there was a neurotic depression and endogenous depression. That time neurotic depression was not biological. It is only because of environmental factors. Now we say that there is nothing like neurodepression, everything is biological depression, MDD. So that means one time which you thought it is not biological, now has become biological. Probably a day will come in the future, maybe after 1 or 2 decades, what all we have said now, all these things may become biological. There is a biochemical basis for our temperament also. That's what I'm telling. Tomorrow, jealousy is going to be dealt with the neurological, neuroscience basis. So for anger, outburst, impulsivity, hostility, all these things, there is a neurological basis. So when there is a neurological basis, even for our personality traits, even inferiority complex or whatever it is you call. So when there is a neurological or biochemical basis for even for our personality traits, then definitely there should be a medicine. There should be a chemical. When there is a chemical imbalance, there should be another chemical which will counter that. So that is what I am going to tell. So today, what all we have discussed may not be still research has not proved perfectly. So probably tomorrow, all these things may come under as there is some biochemical or neurological basis or neuroscience basis. Then definitely the role of medicines will be much more in future, and the role of psychotherapy may slowly diminish. That is one apprehension. But both should go complementary. Probably the dominant thing will be taken by the biological or neurological, and the complementary will be done by the psychological techniques. That should be there. That's what ultimately it will happen.
Okay, yes, sir. You're right, sir. And I have heard one discussion on neurobiology of love also. So I don't know in that fashion where probably a day will come when medicine will come for that too. However, it's a very, very interesting discussion today. I think we have learned a lot about this interesting topic. So I'm now handing over the mic to the organizers. Thank you.
Thank you. Thank you, Brahma.
Dr. Das, would you like to comment? Das, sir? You have to unmute yourself.
Sir, unmute, sir, unmute. Das, sir. Not audible.
Thank you, Dr. Reddy. It is the topic is itself generated a lot of interest, and discussion was much more interesting. As you say, you don't neither support nor oppose this view. I was going through the chat box. Many people are a little skeptical about the new topic. Any new topic comes like that, people will be skeptical. I hope time comes when things will be different altogether, because your thought of cognitive enhancer or mood enhancer, they are a little primitive state, so people are a little skeptical. I hope things will be changing. But this different of view is very interesting. That's what psychiatry is. Whatever I say, everybody should not follow it. Whatever you are saying, although you speak very passionately, I like your passionate way of speaking. But when I read chat box, people have their own views and comment. That's nice. Thank you very much. We made our day today. Thank you, Dr. Reddy.
Yeah, one thing I want to say. So probably any new thing comes, people think it is eccentric, it is odd. That's what I have seen. Many things which are proved eccentric are later they have proved to be right.
Yeah, it's true.
So probably I think this cosmetic psychopharmacology may be such a topic which now people think it is odd or skeptical or eccentric or crazy. This fellow is crazy, why he's talking like this and all this. Probably a day will come when these things, that's what my purpose is, only to sensitize our colleagues about this subject and be prepared. If it becomes true, okay, accept it. If it doesn't become true, okay, just leave it. So many things have come and gone like that. So let us be open. Let us be neutral or open to this and accept it. Whatever it as it comes, you take it and accept it. That is my final say.
Dr. Tufan, sir.
Yes, I have made initial comments, but you actually utilize this privilege to profusely thank Dr. Indra Ramaswamy for presenting this controversial topic and making it controversial as he planned. If you think it's controversial, it is so because it has roused interest. And rather than a old concept, it is a peep into the future. Maybe in future, the dynamics of psychiatric treatment may change in that direction to the degree which we do not know. But it is welcome. And it is a very good topic, well presented by Dr. Reddy, as he always does. Thanks, Dr. Indra.
Thank you, Tufan and Aleem and Amrit and other friends.
Sir, so I'll give the formal thank you if I'm audible.
Yes,
so
yes.
On behalf of the organizing team and IPS Odisha State Bank, I would like to thank Dr. Reddy. When Dr. Aleem asked me what is the topic, I told Dr. Reddy is the topic. Don't have to worry anything. If sir comes, you just have to don't worry about the topic. Any topic he speaks in a different manner. He has a different way. So we all have to learn from him how to create interest, keep the interest, and maybe make us go back and study. Thank you so much.
Frankly speaking, I didn't take any psychoactive substance, Amrit. I didn't take anything before this class. Somebody asked me, have you taken anything? No, I didn't take.
Thank
you,
Dr. Das, for thank you. We are nobody to allow.
Yeah, that I will have now. That I will have now after this.
Dr. Raju has also, NN Raju has also made a comment. Presentation is good.
Yeah.
Dr. Raju, you want to add something, sir?
Raju Garu.
Dr. NN Raju, sir, our President-elect is on board. Dr. Raju, sir.
Sir, please unmute.
Hello. Sir, please unmute.
Yeah.
Sir. Dr. Raju, sir.
Yes. Yeah, basically the presentation is extremely good. I think even by Dr. Reddy's standards, it was better than his previous presentations, I believe. I may not entirely agree with the concepts, but the way in which he absolutely made us agree to whatever he said is brilliant. So I appreciate picking up such a novel, as he always does, a novel topic, and also making us really, his presentations have always been enjoyable one and entertaining one. Sir, continue with your habit of entertaining people. Thank you so much.
Thank you, Raju Garu. Thank you so much for your compliments.
Thank you, Raju, sir. Thank you, Raju, sir. Dr. R.C. Das, who brought us into the topic, who talked about a little bit of history, the evolution, and the way he talked about methylphenidate being used by pilots was wonderful. Dr. Arvind Brahma, a close friend, who is more into spirituality. I thought he would add a little bit of spirituality, a little bit of those into this talk. Maybe someday we'll call you for that. Thank you.
Thank you
for all our
Amrit.
viewers who are always. We had more than around 250 logins today, sir. A peak of 175. That is great. We had around 350 registrations. Thank you all our listeners, viewers, and who have supported us throughout. And we'll be sending your certificates, participation certificates to you. Thank you, IPS Odisha State Branch, our President, Secretary, and our CME chairpersons for always supporting us, never, allowing us a free hand and letting us do the way we can do. And that is why we're trying to do our best. Thank you, Dr. Tufan, sir, our guiding light. Thank you so much, sir, for being there. Our backroom team of Sazia, Rucha, and Sharda. Thank you, Ali. You look so good today. Thank you, Torrent, and thank you, everybody. Good night. Next time, we have Dr. Janardhan Reddy speaking on OCD. So I hope we'll have a wonderful session next week also. Same time, Thursday musings. Bye-bye.
Bye.
Good night.
Good night. Good night.
Good night, everyone.
Thank you, Arif,
Good
sir.
night.
Good night. Good night. Good night, everyone.
Wonderful.
See you, everybody. I think Pawan,